Would you mind explaining to me what the fourth trimester is?
The fourth trimester it's quite a new concept using that language, but trimesters are thirds, and what I think particularly medicine forgets is that you have to, all those changes of pregnancy have to go away somehow, and you don't suddenly miraculously, I have the baby now, ping, all my muscles, all my hormones, all my thoughts go completely back to normal. That's impossible. And you think, well, why didn't we really make a big deal of this before? And I think historically and medically we've kind of said the postpartum period is about 6 weeks after you've had the baby, and that's because if you don't breastfeed, that might be when your periods come back, and it might be when you look less physically obviously pregnant, because of course when you have the baby you still look pregnant. I don't know if you know that.
I did not. No, I didn't.
But in reality it's probably more than 6 weeks. It probably is more like 3 months. And of course every woman's different. Some people do ping back to what they feel is normal very early, and other people take even longer. And it's a combination of physical, hormonal, mental and emotional changes, and things like how long does it take for my abdominal muscles to get back to normal? Well, partly depends on what they were like beforehand, partly depends on how stretched they got. For example, if you have twins, it's going to take a lot longer. And whether you've been doing any activity on them during the pregnancy, but it can take at the very minimum 6 to 8 weeks, and probably far more like 3 months before there's sufficient tone in those muscles to sort of be heading more centrally. And really, just like in the last third of pregnancy, you won't get them back quickly by doing hard abdominal crunches. It's very gentle until you can actually feel them going back. And sometimes people notice themselves, if you make a fist and sort of put it at your tummy button, there's a bit of a gape, and maybe every few weeks that gape feels a bit smaller. And that's not to say you shouldn't do anything, but you shouldn't be doing hard abdominal core work until they've naturally started to come back a little bit. You can help them along a bit gently. Exactly the same as the pelvic floor. Women often say, well, you know, when should I start them? Well, I hope it's no surprise to you that your pelvic floor may well be a little bit sore after childbirth, but the sooner that you can gently get into doing that, the better. But of course, you've got to stop being uncomfortable first. And I suppose the discomfort is a few weeks, but the rest of those changes will take a few months. And if you're breastfeeding, the hormone relaxin that you produce in pregnancy to soften ligaments, that's still going, whereas if you're not breastfeeding, that will drop off a bit. So those things like joint instability and gait will go on for longer possibly if you're breastfeeding, and that mustn't be a reason not to breastfeed, but it's taking that into account. Why somebody may not take as long as the person that they went to parentcraft with, you know, to be in the same way. There's a big social construct that women should go back to their pre-pregnant self as quickly as possible. You will never be your pre-pregnant self in all of those spheres. It's such a misunderstanding to think that you can go back to emotionally, mentally, physically what you were before you had your baby, and society makes that really difficult for us to accept. It causes such misery. And having a practice like yoga where you value yourself for where you are in the present and not constantly hark back to what you were 9 months beforehand, is really good for that anxiety. And we know that all of those mental health issues, not even if they're sort of a labelled problem, if we think they're going to get worse in pregnancy, they get even worse postnatally. Because now you do have this thing that you are responsible for, you're sleep deprived, you're meant to be looking all serene and glowing and happy with your lot, but actually you're juggling all this emotion on the back of lack of sleep, on the back of feeling sore, on the back of not feeling yourself. And that sits between medicine and midwifery and society. And women get caught in the middle of all of that, and possibly yoga is the thing that can help them anchor to the new me, rather than always wanting to go back to the comparing and going back to the old me.